Guidance for universal masking. In a healthcare settings, first and foremost, a mask is a core component of personal protective equipment healthcare workers need when caring for symptomatic patients with respiratory viral infection in conjunction with gown, gloves, and eye protection. All healthcare workers, inpatient unit, ambulatory unit, and procedural areas will be expected to wear surgical face masks at all times, while in their respective clinical settings. This universal mask approach will serve to protect patients and healthcare workers from exposure to infection from asymptomatic COVID-19 infected healthcare workers. Protect healthcare workers carrying undiagnosed asymptomatic COVID-19 infected patients or patients have mild COVID-19 infections that have not yet been recognized. A single mask can be worn across different cases and between cares of different patients. When providing care to a patient with known or suspected COVID-19, the mask should be removed and wear new one after hand hygiene. Masks must be changed if they become wet or contaminated during a case. Surgical mask is not allowed to be worn outside clinical care areas. Surgical mask is not allowed to be hung around the neck or kept in the pocket. Personnel working in non-clinical areas where persons are reliably separated by more than 1.5 meters should not wear masks, and when walking through common clinical areas where care is delivered, the mask policy applies. Stop at an entry point prior to entering the clinical area to use surgical masks. These employees should practice principles of social distancing, respiratory etiquette, and frequent hand hygiene. How to use and discard surgical masks. A surgical face mask will be used at the start of each shift. For those individuals working in clinical areas, masks will be available at each entrance to the unit and will be used throughout the shift. In the event that the mask become visibly soiled, wet, or damaged, a new mask must be used. At the end of the shift, healthcare workers will be asked to doff their face masks as they exit the unit. Medical waste container will be placed at each exit for the used mask to be discarded. Thank you for watching. Please subscribe and click the bell notification button for more updated videos.